Hi, I'm Dr. Venkatesh, Head of Cardiology at the Aster RV Hospital, JP Nagar, Bangalore. Today, I am going to talk about electrical devices used in cardiac diseases. So we are talking about devices known as pacemakers. You might have also heard of implantable defibrillators and also a third kind of device called cardiac resynchronization therapy, also called as a heart failure device. So I'll be talking about each of these things: pacemakers, defibrillators and heart failure devices in three separate sections in the coming video. Now, heart, as we all know, is a pump. For the pump to function in a regular fashion, the heart has to receive electrical impulses. Now, these electrical impulses are generated within the heart. There is an area in the heart in the right atrium called as the sinus node, from where the electrical impulses are generated. And from this place, these electrical impulses are distributed into another place called as the AV node or atrioventricular node. From the atrioventricular node, which is like a distributor, the impulses will travel to the rest of the heart. So, an electrical impulse is generated in the sinoatrial node or the SA node. From there, it will go down to the AV node, and from there, it gets distributed to the rest of the heart. Now, if there is a problem in this process, the patient can get slow pulse rate or slow heart rate. So these kind of conditions where the pulse rate becomes very slow, we call as bradyarrhythmias or bradycardias. That means slow heart rates. Now there are two main kinds of slow heart rates which we talk about commonly in clinical practice. One of them is known as sinus node disease. Now in sinus node disease, what happens? The sinus node or the sinoatrial node, which is supposed to generate the impulse, is not generating the impulse at the right speed. We all know that the average heart rate is about 72 per minute. We accept heart rates between 60 and 90 per minute as normal. If the heart rates fall below 60, we call it as sinus bradycardia. If it becomes very slow, let us say below 35 or 30, or supposing between two impulses, if there is a long gap, then patient can get some symptoms. If the pulse rate is very slow and we need the pulse rate to be high, for example, when we are trying to walk, the pulse has to go faster. If we are sleeping, the pulse can become slow. But for any given circumstance, if the pulse is extremely slow, patient can get tired. If the pulse is absent for some time, for example, 2 seconds or 3 seconds, if there is no pulse, then the patient can even feel giddy. Sometimes the pulse is absent for such a long time that the patient can actually faint. So this kind of difficulty in generating the impulse is known as sinus node disease. Now many times sinus node disease also has other problems, like instead of slowing down alone, the sinus node also beats very fast. So you could have a combination of fast heart rate and slow heart rate in the same patient with sinus node disease. We call that as tachybrady syndrome. So basically, if the sinus node is not giving enough amount of impulses, the heart can slow down, and that's one of the times when we have to put in a pacemaker. The second type of slow heart rate is called as heart block. We are not talking about blockages in the arteries of the heart. Those cause heart attacks and all that. We are not talking about that. What we are talking about is when the impulse is generated from the sinus node, it can reach the AV node in a delayed fashion, or it may not reach the AV node, and from there is no impulse going downwards to the rest of the heart. So that means there is a disconnect between the upper chambers of the heart and the lower chambers of the heart. So this is called as heart block. Sometimes when there is a total disconnect between the upper and lower chambers, the upper chamber beats independently at a faster rate, the lower chamber becomes very slow, and that kind of a condition is called as a complete heart block. So if there is impulse transmission which is impaired, then this is called as heart block, and that's another condition where we put in a pacemaker. Now, what is a pacemaker? As I said, pacemaker is an electrical device, and what happens is, now this is how a typical pacemaker looks. It's like a simple watch-sized device. Now this device is implanted under the collarbone on the left or on the right side. From this device, wires are extended into the heart chambers. So now this is a wire. These are called as leads. One end of it is attached to the pacemaker. The other end goes into the heart through a vein. Now the tip of this wire has a sensor, and what it does is it detects the impulse which is generated in the heart. Let us say either because of sinus node disease or because of heart block, the heart is slow. The pacemaker is able to detect that, and then the pacemaker fires the heart. It gives the impulse on its own. So it's an automatic device which can detect the times when the pulse becomes slow, and it will give the impulse from its side. So it's like a UPS in your house. If the electricity goes down, the UPS switches on the light. Exactly the same way. If the pulse is normal, the pacemaker sits quietly observing what is going on. But supposing the pulse becomes slow, we can set it anything. So let us say I don't want the pulse rate of a patient to be less than 50. So I set it at 50. The moment the patient's pulse rate goes below 50, the pacemaker will start pacing at a rate of 50. So this kind of sensing ability as well as firing ability, or called as the pacing ability, is there in this this device. So this is what is called as a pacemaker. Now, how is this pacemaker implanted? It is a small surgery. As I showed you, the device is a very small device. It is probably an inch or an inch and a half in length, and thickness is a few millimeters, half a centimeter maybe. So what we do is we make a small 1.5 inch cut under the collarbone, and the pacemaker is inserted into that. Through the veins in that area, the wires or the leads are inserted into the heart, and these are connected, and the wound is stitched up. Typically the procedure takes about an hour and a half, and then patient is moved to the room, and in a day or two the patient can go home. The stitches which we put are either absorbable, in which case the patient doesn't even have to come for stitch removal, or otherwise if the stitches are not absorbable, the patient comes back after 1 week to get the stitches removed. There are some precautions about movement of the hand towards which the pacemaker is implanted, but after that the person can be completely normal, can resume most of the activities. The pacemaker takes care of slow pulse rates. Now, are there different types of pacemakers? Basically, we talk about, in terms of slow heart rates, two types of pacemakers. One of them is called as a single chamber pacemaker. The other one is called as dual chamber pacemaker. Now, a single chamber pacemaker has a single wire, and the pacemaker sits here. A single wire goes into one of the chambers of the heart. Let us say the sinus node is not working well. The upper node is not working well. It is not generating the impulse. So we can put in a wire into the upper chamber of the heart, and using that single wire, the pacemaker can detect when the pulse slows down, and when the pulse slows down can give an impulse. The rest of the heart electrical system, the conduction system, is normal. Therefore, that single wire can take care of that patient's problem. Similarly, there are some conditions where the pulse rate is very irregular, and because of that the pulse becomes slow as well. At the time, we implant a single wire into the lower chamber called as a ventricle. So this single chamber pacing is sufficient in a patient who is elderly and has irregular pulse rate. So this again is called as a single chamber pacemaker. So you could have a atrial single chamber pacemaker for the upper chamber or a ventricular single chamber pacemaker for the lower chamber. The second type of pacemaker is called as a dual chamber pacemaker. There are times when we have to be sure that both the upper chamber as well as the lower chamber work in tandem. The upper chamber pumps, then the lower chamber pumps. So for both of this to be synchronized properly, we need a dual chamber pacemaker. A dual chamber pacemaker has two wires. One wire goes into the upper chamber, the other wire goes into the lower chamber. Now the wires detect if the electrical current is flowing properly or not. If there is a problem, the upper chamber fires the upper chamber, the upper wire fires the upper chamber, and the lower wire fires the lower chamber. So both the chambers, the upper as well as lower chamber of the heart, the atria and the ventricle of the heart, work in tandem so that the patient's heart works in a synchronized manner. There are some other advances in pacemaker technology these days. There are different kind of monitoring that is possible, recordings that is possible. There are times when irregular heart rates can be suppressed by a pacemaker. There are times when pacemakers can detect if there is excessive water content in the lungs of the patient. So these are all advances which are used for different purposes. But I would like to talk about one specific advance which has happened recently. We all know that there is a scanning technique called as MRI, magnetic resonance imaging. This is usually like a CT scanner but a large magnet, and it detects abnormalities in the body. From head to toe, MRI can be done. Now, pacemaker being an electronic device, we cannot take it near the magnetic resonance imaging machine because the magnetic field of the MRI can interfere with the working of the pacemaker. So therefore, there was a time, maybe a decade ago, that if a patient has a pacemaker, for some reason if that patient requires an MRI of the head or of the abdomen or the spine, an MRI could never have been done for such patients. So now, to address this issue, scientists have come up with what is called as an MRI compatible pacemaker. Now these are pacemakers which when implanted, the patient can go and get an MRI done. We all know that pacemaker related problems happen in the elderly, and we know that above 65 years of age, almost 1/3 of all patients, all people will require some or the other kind of MRI in their lifetime. So therefore, it will be not a great idea to deny MRI scanning just because of a pacemaker, and therefore these MRI compatible pacemakers have been discovered. So now the state of the art is MRI compatible pacemakers. Therefore, once the pacemaker is implanted, the patient can still go and have an MRI if for some reason it is needed in the future. So quickly recapitulating this, I told that there are some problems where the pulse rate slows down. It can be a sinus node disease or a heart block. In either case, when the pulse becomes very slow, patient can develop symptoms. To overcome these, pacemakers are used, and the pacemakers can be single chamber pacemaker or dual chamber pacemaker. And these pacemakers detect the functioning of the heart. If the electrical impulses of the heart become slow, they will provide the impulse so that the heart doesn't stop for a long time. And lastly, I told you that there is a new advance in pacemaker technology called as the MRI compatible pacemaker, and that is now used for most patients because these patients will require MRI at a later time. Now, pacemaker procedures are very simple. While we think that this is some cardiac procedure and we get scared about it, I can assure you that it's a reasonably easy operation. The risk to the patient is very low, And wherever pacemakers are required, we can comfortably go ahead and get these done. And in our hospital, we have the technology to implant both single chamber and dual chamber pacemakers for various kinds of slow heart rates, and the state of the art equipment like MRI compatible pacemakers or the other pacemakers with multiple advancements are available with us, and you can always seek our opinion whenever a pacemaker is advised to you. What are the precautions to be taken once a pacemaker has been implanted? So that is a common question asked. I would like to address that. Now, an important thing is that when we go into the airport, there is a handheld scanner or there is a radiation scanner to look for metal detectors. The pacemakers are not affected by either the handheld scanners or the walk-through scanners when we go. Again, questions about whether we can use the microwaves or we can watch television or operate electronic instruments in the house, telephones especially, is also asked. Now, all of these instruments are safely used. The only precaution we advise is for patients to not keep a telephone directly over the instrument, because the magnet in the speaker of the phone can sometimes interfere. So the patient can use the telephone on the other side or keep it at a distance, and that should not be a problem. So once a pacemaker is implanted, normal life can happen. If it's an MRI compatible pacemaker, even getting an MRI should not be a problem for patients. So a pacemaker is a safe device to wear, and most of the activities are allowed, and most of the electronic equipment which we use in our day-to-day life can be comfortably used even after implanting a pacemaker. Thank you very much.